Well, good morning, everyone. Thank you for joining us today. If I can introduce those of my team that are here today, I'm Jo Laverty. I'm the National Organiser for the Orchestras Department. We have my colleague, Maurice Stemp, if you'd like to give us a wave, Maurice.
Oh, hi.
I think my co-pilot, as we call him. And Jennifer Tate, if you can give us a wave.
Morning, everyone.
Jennifer's the one who has set up all these events and done a marvellous job. So thank you, Jennifer. And Jennifer and I are going to facilitate today in terms of looking out for your hands when there are questions, and also for looking for your comments and questions in the chat. So I will now hand you over to our two expert practitioners we have here today from BAPAM. For those of you who are not familiar with BAPAM, it stands for the British Association of Performing Arts Medicine. And we know that huge numbers of our members use the BAPAM services, and we get very great feedback about them. And today we have Mark Phillips. Mark is a hand surgeon with a particular interest and speciality in treating hand and wrist problems in musicians. Mark, if you can give us a wave.
Hello. Yeah.
And Penelope Roskell, who is an international concert pianist and is also the piano educator for BAPAM. And she has many years of experience of helping injured pianists to resume healthy piano playing. So we're going to be looking at sort of, causes and issues, but also very importantly, preventing injury and also playing beyond injury for those of you that have unfortunately had an injury. And with that, I shall hand over to Mark. First of all, I should say, for those of you that are already desperate for your next cup of tea, we will have a comfort break in the middle, so don't worry too much. We're not going to go through the full 2 hours without breaking, but Mark's going to start and then we'll have some questions and then we're going to have a break. Thank you, Mark.
Yeah, marvelous. Thank you very much. Thanks for this opportunity, Jo and Jennifer and Maurice. We were headhunted for this because we gave this talk through BAPAM with the RSM as well, and it was quite well received. I'm just going to go to presentation mode. Can you see this now? Is that good?
Yeah.
Yes. Okay. And we've given it twice now with the RSM and BAPAM, and it was really to talk about pianists and hand surgeons work together in a sort of technique pedagogy hand surgery way. But we're going to broaden this today to talk about orchestral musicians, obviously, and we'll talk in a more general sense about musicians. Yeah. So yeah, I'm a hand and wrist surgeon working in London, and I was an NHS consultant for 15 years. And 5 years ago, I went full-time private, but I also have an NHS choose and book practice, which is very busy, which allows most musicians to be able to see me. And I inherited this practice when somebody wanted to hand his practice on. Ian Winsler and John White wanted to hand their practices on to somebody with an interest in doing this, and I happen to be an amateur trumpet player, so I ended up with the gig. And it's just been a roller coaster ride and such a joy since then. And then I came across Penelope with her extensive experience, and we formed a partnership and started working with BAPAM. We'll talk a bit about the clinic that we've set up, and then we'll talk about the kind of work that we've been doing together. And I'll let Penelope introduce herself now.
Yeah, so I am a pianist and I teach piano, but I'm going to try to avoid just focusing on piano playing at all today, because I know that most of you are orchestral musicians, although I assume some of you probably play the piano to accompany students or whatever. I know some orchestral musicians do. So I'll be talking about more general things about how we look after our hands as musicians, as working musicians. I did about 20 years ago, I created I was doing a lot of sessions then for more general musicians, and I created a DVD called Yoga for Musicians, which was showing how we could use yoga principles for musicians playing any instrument. So I'm going to be using some of that as a sort of backup for basis of what I'm saying today.
Okay. And I've been trained in being a page turner by Penelope, and so hopefully get the timings right. Pianists can be like about the page turner not doing a good job. We're going to talk a little bit about BAPAM. I mean, you presumably do know a little bit about BAPAM. I think if you've got a health issue and you're a musician, I think it should be high on your list of places to go for a bit of steering as to what's available, signposting, etc. They're just a marvelous hub for all of that. And they've got all of these fact sheets, education events, clinics, support, and all sorts of signposting. So it's a marvelous organization. Okay, so today we're going to talk about how we came to set up the Pianists Clinic, how other clinics have come off the back of that, and then I'm going to talk about the common conditions that I see, and then I think we're going to take a little comfort break, and then Penelope is going to talk about prevention of injury, and I'm going to talk about treatments that we commonly use for musicians, and then we'll summarize. We'll have lots of opportunity for questions as well. We'd like you to ask us lots of questions. So, how did this clinic come about? Well, I'm a hand surgeon, and I inherited this practice to treat musicians, but basically I work in London Sports Orthopaedics, which is alongside some sports physicians, and I was rather jealous that as soon as I inherited this musician's hand practice, that the world of sport has elite sportsmen who are supported by doctors that have an interest in say, tennis. So if we're talking about tennis, there'll be tennis doctors, and there'll be tennis physios, and there'll be tennis coaches that all know a lot about the injuries that happen in that sport. And then I became aware that music doesn't really have that. And I wanted to create something
No, come on, sweetie. It's definitely time to count. Come on.
And so so Penelope came along, and I thought it'd be marvelous to work with somebody like her, because I realized, although it'd be nice to see people on their instrument, there's all sorts of skills I didn't have about interpreting the subtle signs of somebody with something about their instrument, or something about their technique that could be amended in the light of the clinical condition that they have. And so through BAPAM, we thought this was going to be a perfect forum to make this happen. And we discussed it with BAPAM, and we came up with a plan to make it financially feasible. And all of this was done on the premises in the BAPAM building before lockdown. And then, of course, it's all changed to online now, which in many ways has been better. And so this was the idea, that we wanted to have some convergence of knowledge between a therapist and a technique educator and a physician. And it soon became apparent how little knowledge I had of technique modifications that are available for different musical instruments. And the technique educators have been invaluable in teaching me a little about that. And the therapists have also been enjoying learning a little bit about this as well, and what's possible. And I spend more time learning about what they do too. So in terms of the spectrum of need of patients, essentially, some patients only need technique modifications, some patients only need the use of a hand surgeon, some patients only need the use of a hand therapist, that's a specialized trained therapist that has done a hand therapy diploma. And some patients, you could argue, just need a psychological support. And patients sometimes know that they need only one of those things, but very often people need more than one of those things. And so this is where this co-working concept comes in. So over to you, Penelope.
Oh yeah, so the musicians who benefit from this type of joint clinic, and although Mark and I run a pianist clinic, Mark will tell you in a minute about some other collaborations he has with other instrumentalists. So I think people who benefit from it are ones who have either sudden or long-standing playing-related injuries. There are sometimes musicians who have a more long-term condition, say arthritis, or they've just had an operation, and they just have found that their playing isn't the same as it was, and they maybe don't have the same stretch that they had, so they need to be helped to find some workarounds so that they can keep playing at very, very near to their original level of playing. And we tend to focus on complex cases that would benefit from a joint approach. If somebody obviously only needs, they've got a straightforward injury and it just needs a quick medical intervention or some just technical adjustment, then obviously we see them independently.
Yeah, so, and then at the end of this joint clinic, which is now largely online, we will decide what we're going to do about this patient that we now co-own. And either it'll be that I'll see them in my clinic for further workup or treatment, or that we suggest that they need a rather more of Penelope's services, and so they'll come and see Penelope a bit more. or one of my other technique pedagogues, who we'll talk about a bit more in a minute, or they'll continue to see us both, and we'll liaise with each other about how things are going. And sometimes that advice of that single session is rare, I have to say, that the advice is sufficient and no further appointments required. Or it might be that we all decide that what they really need is some hand therapy, and possibly they can have that closer to home rather than traveling all the way down to London to see us.
Or there may be some other, sorry to jump in, Mark.
Yeah.
There may be some other sort of therapy that we recommend. You know, BAPAM has a list of recommended therapists such as physios and osteopaths and so on. So we assess each person and think, well, what might be most useful for that particular condition.
Yeah. So as an output for that, if patients don't have any private healthcare insurance, which most musicians don't have, we've got this marvelous NHS Choose and Book clinic service set up by John White largely, and patients can, and there's information on my website, we have a link to that later on, about how patients can be referred to me from anywhere in England, sadly not Scotland or anywhere else. They can be referred to me as an NHS Choose and Book patient, and the beauty of that is that even those appointments can be now video or telephone consultations, and we can minimize travel to London. So it's been absolutely marvelous, I have to say, the convergence of having an NHS clinic as well as being able to do that online with people. We've been able to really manage that. So the other technique pedagogues I work with, Paul Anders Soga has been absolutely marvelous. He's an A-level psychology teacher, a talented guitarist, an Alexander technique teacher, and a life coach, and a jolly, thoroughly nice chap. And he's basically been my guitar advisor since lockdown started. I've never met him in person, people meaning to meet up. And he lives in Guildford. And his website, PAS Guitar, PAS Guitar, tells you a lot more about him. And we've done some joint sessions together, not funded by BAPAM, I have to say, but that's perhaps a work in progress. We'll perhaps persuade BAPAM to take on him in the same way that they have with Penelope for at least one session. Which brings me also on to Alison, who's been marvelous too. She's joined us today. She looks after orchestral musicians. She's a violinist herself. Alison, I don't know if you want to just say hello. Unmute yourself. Are you there? Oh, I'm quiet. A big introduction.
Sorry, forgot the.
She was there.
She was there.
I am here.
Hello, Alison. How are you?
Hi, I'm fine, thank you. I just forgot.
Good. Good to have you with us. And then with John White on percussion. John White was the hand surgeon that set up the NHS Choose and Book clinic at Hendon. He's gone back to Australia. He handed over this practice to me a few years ago. But because he was Young Australian Musician of the Year 1981 on marimba, and spent a lot of time setting up this hand clinic, he's very happy to, for the price of a donation to BAPAM, i.e. a music lesson cost, he provides 45-minute sessions with me as well, with people on their kit, and he's on his kit in Australia, and we can look at whether there are any technique workarounds on percussion too. So that pretty much, between guitar, orchestral instruments, Alison has to be said, doesn't just do strings, she's a violinist, but she does other instruments too within the orchestra. Alexander technique teacher, and a talented musician herself. And so that really pretty much covers everything. I'm a bit short on advisors for saxophone, woodwind. Alison does some of that within the orchestra too. She teaches Alexander, of course. But it pretty much covers everything. And then over to you, Penelope.
Right. Yeah. Well, so in this clinic, that my role is assessing problems really from the instrumental point of view, and also just talking through with a musician what could have been any playing related causes. I mean, not all injuries are playing related. I mean, some of you just fall on your wrist or whatever. I suggest some very practical modifications to technique. If it's not an instrument I know about, then I'll pass you on to somebody who knows much more about it. And I find also that just having had the experience of as a student, having had an injury myself, I can give reassurance to the musicians about what they're going through. I can also sometimes just be their advocate, sometimes because sometimes they go for a talk with a medical person, it all happens very quickly. They don't have time to take it all in. They don't understand some of the terminology. So sometimes I can just help to understand, and we can make a joint decision about the way forward.
Yeah, so we thought we'd just give you a little summary of some of the patients that we've seen. They range from technique, as we said, just technique adaptation through to medical intervention and everything in between. And we've got some total successes to some what we call mixed results, I suppose. Very early on, we had a patient that I referred to Penelope, a young organist. Could you explain about that one then, Penelope?
Yeah, so he was young, he was at a specialist music college, so he was playing a lot. He developed fifth finger pain. This was a very simple one. I saw him once. I modified his technique. He was reaching out his fifth finger all the time. Instead of moving his arm, his forearm and his wrist so that the arm was positioned more behind the fifth finger. And as he was working around that, and within a couple of weeks, the pain had completely gone, and he hasn't got back to us. I'm assuming he's still fine. So that was a very quick and easy one from
Yeah,
my
we
point
had
of view.
emails back from his parents, didn't we, saying that?
Yeah, we had a lovely email saying that he recovered fully. Yeah.
And so these referrals go both ways. So I sometimes send patients to the joint clinic that I think would benefit from Penelope's opinion, and she will send them back the other way. So one that Penelope suggested that saw me had a clinical condition. She needed a steroid injection. That helped a lot. And slowly over the course of last year, I gather she's improved. You've been looking after her, haven't you, Penelope, since?
Yeah. The steroid injection helped enormously. We looked at her technique, but the steroid injection just what's the word? It's sort of something started quick, whatever the expression is, jump started the recovery process when it'd been slow and frustrating, and that just helped to get over it, and she recovered much more quickly as a result.
And we'd hate for you to think we cure everybody. If in a clinical scenario, it's just not possible to cure everybody. We can do what we can to help, and we've got patients who still have ongoing symptoms, and we're aware of that. This last one example, Penelope.
Oh, so yes, so this is somebody who'd had an operation on her third finger. I think she'd had a bad cut, an injury. And unfortunately, this led to tonic movement in her second finger. So that meant that the second finger, whenever she was playing the third, would come up involuntarily. This is known as focal dystonia. It can be very, very difficult to get over. So in those sort of situations, we work together as a team. I mean, Mark and I are part of an international team now where we discuss cases and try and sort of form the best practice for them. But, this is a very, very difficult condition to treat, and we've had mixed results so far, but usually people improve, but how much they improve depends on many different factors.
So then, so what are the difficulties with this really? The stakes are very high for musicians. They feel very anxious. Very often they don't really want to come to a joint clinic because they really don't want to enter into any concept of just rediscussing their technique. And I'm always quick to point out that this isn't about criticizing their technique. It's more about finding a workaround if they're going to see a technique pedagogue that can provide helpful solutions to now that they've got this clinical condition. But they're often quite anxious, aren't they, Penelope?
Yes, and of course, because we both have the background in music, and Mark also is an amateur musician, we both understand that, and I think that's incredibly important for anybody with any distressing injury, that they feel they're being understood and listened to. And we're aware of the fact that many musicians, after all of the last 18 months, are also, maybe feeling quite depressed or anxious about the future. They may be nervous of injections or surgery. I don't like them myself, I must say. And there are concerns about if anybody suggests a change of technique, will that throw everything out, and will that make their playing get worse for a time? So yes, these are understandable concerns, and they're things that we address when it's needed.
So yeah, that's an introduction into the joint working clinic. Is there any discussion around that, or any questions or any points that anybody wants to make about what we suggested there so far? This is new work. We went along to PAMA last summer to present our work, didn't we, Penelope? And part of the reason of doing that was to find out whether anybody else anywhere else in the world was doing something similar. We asked that several times, and we got no comeback of anybody sort of doing such a joint working clinic. So I don't know that anybody else is doing this, we'd like to hear from anybody who is, because we wanted to help. Well, we could learn off each other. And the only thing that came of that was that we had somebody from Singapore that was wanting to set up one of these clinics, and we had a chat with them about how they might go about it. Yeah. Are there any other questions about joint work in clinics?
There's a couple of things.
Yes. Okay. Let me just get rid of this chat then. Right, so I was going to talk about the common conditions I see. So a lot of people say, musicians' hand clinic, what is that? Is that a special thing? Do they have special conditions? Well, I'll tell you about how my clinic's growing a bit, and I'll tell you about the sort of conditions that I've seen. So I inherited this clinic in 2016, and at that time I still had a lot of sports patients to see, and 90% of my patients were bankers in the city, and I was seeing a few musicians at that time. And it's got bigger every year. My son's written me some super software to analyze my letters, to look up for words, and I'll show you about how that's working in a second. But it's shown me that my proportion of musicians in my clinic is now the majority. So at 70, I see about 50 patients a week, 20 new patients a week, and of that, I would say more than half, about 12 or 13 patients a week would be musicians. It's crazy now. It's really busy. And what conditions do musicians get? Well, it's the same conditions as everybody else: carpal tunnel, trigger finger, ganglions, etc. But the effects are different on musicians, and often affects musicians even when they have fairly mild levels of all the conditions that I see normally. And the other half are instrument-specific things to do with the technique or the way that the instrument interfaces with the hand. And as an aside, if I may, I'm just currently putting together a really a gallery, a photo and video gallery of how the hand interfaces with different instruments. So I'm inviting musicians to send me photographs of close-ups of the hand in different positions on their instruments, so I can better understand. Now, whilst I'm getting the idea of what it's like on a saxophone, or there are other rarer instruments like medieval flutes and things like that, or Northumbrian pipes that I'd be interested to see. And I think a lot of other hand surgeons and hand therapists would like to be able to use that resource, which I'm going to put online for people to be able to access. And so, yeah, those and things like the interface with the instrument then generates some things which are classics for certain instruments, which we'll come on to shortly. These are the figures that Ian Winsper put in his book: piano 20%, guitar 20%, violin 20%. I think that's possibly right. You'll see my figures are slightly different in a minute, because a lot of people are piano second instrument, and so they mention piano as well when they come to see me. Cello is coming a lot at the moment, and because there are relatively few harpists in the world, I do see them rather more often than you'd expect. Let's go back. The main conditions I see are tendinitis, and tendonitis, essentially. A lot of people come to me and say they've got RSI, which is, for me, I want to find out exactly which tendon it is. There's all these on the flexor side, but then there's all these different compartments on the back of the wrist as well, with lots of different tendons in them, and I want to know which one is the one that's causing the trouble. And so the tendon getting swollen causes trigger finger, it causes multiple tendons getting swollen causes carpal tunnel syndrome. Other tendons around the back of the wrist cause other conditions, and then I see other conditions on top of that. But that's why I do so many steroid injections, is that it's mostly tendinopathy or tendonitis. We use the term pretty interchangeably. And so this software that my son's done for me goes through all my letters, and basically he writes code for banks. He's 26 now and he loves it. So he's basically written me software which recognizes words within all my Word documents. And if I've said carpal tunnel or ganglion or cubital tunnel or trigger thumb or trumpet or violin, thankfully musical instruments tend to have unique names. So things like trumpet, violin, clarinet, they don't form parts of other words. So we've been able to search for them very specifically. So if they've mentioned it in the letter, then I'm assuming that that's what they play. It's a crude instrument, but it's given me some insight into what I'm seeing. And those are the common words that come up. And so basically, and it's pretty, as you can see here, I've got musicians and non-musicians here in this analysis. And essentially, if they are a musician, it's red, and if they're not a musician, it's blue. And the mix is pretty much the same for musicians and non-musicians. Ages of musicians and non-musicians in my clinic are pretty similar. And this is what I've found from this way of analyzing my work, is that piano is twice the next closest instrument in terms of what I see. But as I say, I think quite a lot of those are piano as second instrument, and then guitar, very common, and then all the orchestral string instruments, And then right down the bottom, percussion, trumpet, drums, harpsichord. So yeah, that's by instrument in the last year that I've been. Yeah, same. These are the body parts that seem to be different tendons, different parts of the arm. Actually, genre is not often declared. Patients often say that they play different types of music and genres of music. So actually, that's not a very useful slide. And then I tried to find out whether the word carpal tunnel was mentioned more often for certain types of instrument, and it isn't really, maybe a little bit. I'm not sure if this is statistically significant, but about a quarter of my pianists and guitarists, we've had a discussion around carpal tunnel syndrome, and with the patients that come see me that play violin and cello, that's more just like under a fifth. But overall, it's about a quarter of my patients mention carpal tunnel as probably the commonest condition overall. Arthritis, probably between 7 and 10% of patients would mention that word in the consultation, or we would mention it in my clinic letter. And then half my patients bring up the word tendon, informed tendonitis or tendon disease of some sort. And then there's the instrument-specific cases. There's flautist finger, which is essentially where the flute rubs on the radial digital nerve of the index finger, causing an altered sensation down the radial border of the index finger. It presses on the radial digital nerve just here, where it's rather sensitive to that. And then another form of digital neuroma in the tip of the finger. I'm seeing quite a lot now, particularly in cellists, also double bass players that use the thumb position, and then the string comes to line where one specific alignment on the index finger. And that tends to cause a very sharp shooting, lancinating pain at the tip of the finger, where a swollen nerve is getting trapped between the skin and the bone underneath. Usually the pulp of the finger is thick enough to deal with that, but sometimes when the nerve gets swollen, again, it creates a vicious cycle of swelling and entrapment. A bit like a Morton's neuroma in the foot is where a nerve gets trapped between the metatarsal heads and the skin of the foot when you're walking on it, and that's usually best treated by padding in the shoes and seeing a chiropodist, and maybe surgery or steroid injections. So on that principle, we pad the finger and protect it for a while, and sometimes consider steroid injections in refractory cases. But better than that is to change the angle of attack of the finger onto the string, and that works for guitarists too. I've seen it in all of those instruments, violinists too. Clarinetist thumbs notorious. Bearing the weight of the instrument is a big issue, and how people bear the weight of a clarinet or a saxophone or any other instrument for that matter that they have to carry. There are lots of ergonometric adaptations that we can do to work around that, as well as discussing other things that may be clinically wrong with the weight supporting part of the hand. So yeah, that's a quick ramble through that. So are there any questions about the nature of the conditions that I see in my clinic and the spread of the demographics?
Actually, Mark, there's one more question from Glenn Sheldon in the chat. If somebody could...
Okay, cool. Now I can move this on.
Move on.
I would, but my button's not working. Oh, here we are. It's working quickly now. Okay, right. Over to you then, Penelope.
Right. So I'm going to talk a little bit about prevention of injury, how we practice, and some technical considerations and some possible technical modifications. As I said, as you know, I am primarily a pianist, but I've worked with other musicians as well. So I'm going to keep this as general as I possibly can. Some of this will be very obvious to you, I'm sure, but one cannot repeat it too many times. Honestly, it has to be very foremost in our minds as players, and also I'm sure some of you do some teaching as well. So the most common causes are or triggers or whatever is a sudden increase in practice time. This may be because we've got a big event coming up. We've got deadlines, and that causes stress. It then causes mental stress. It causes then a bit more physical tension, and so a little bit more tense at the instrument, and it can lead to sort of technical problems, some fatigue, and even to injury if it's not addressed at an early stage. We have to be particularly careful when there's a very, very challenging piece. I mean, I know if you're orchestral musicians, you're already on top of most of the very difficult repertoire. You have to be. But if there's anything, say for instance in your students, where they've suddenly got a very challenging new repertoire which they've not done before, or a new technique, it has to be approached gradually, learning the technique in a very simple method first, perhaps a few little simple exercises or studies, before they put it into something more complex. So, as we all know, instrumental playing is a very steady process, and if we try and jump 2 or 3 hurdles all in one go, that can cause some problems. I'm going to talk a little bit about posture and alignment, which I'm sure you're very aware of, but I'll just give you a few more ideas about general principles to bear in mind. Excessive tension in any part, so this might be in the neck, it might be in the shoulders, because those all affect what's going on lower down, particularly in the elbow and in the wrist. We want to keep those to have some give in them, so we're not putting undue pressure on those joints. And yes, inappropriate technique or repertoire for a musician's own physique. It's very obvious that a Mozartian singer isn't going to be expected to sing Brunhilde. Sorry, could you go back a minute, Mark? Yeah, thanks. And so, although again, for instance, pianists, we don't have the option, we have a piano. There are actually smaller sized pianos which are being built at the moment with a narrower key. But, sometimes if you have a small stretch, if you have small hands, you have to accept the fact that there may be certain pieces that it's just not wise to play. Difficult, I know, if you've got to play it in an orchestral setting. And also we should be looking at non-musical activities such as typing, texting, sports and so on, because so many musicians do a rehearsal and then in the break they are just then either texting or typing, so they're using their hands again, so they're not resting their hands. And so I very, very often in the clinic I'll say to somebody, I want to see them play their instrument, but then I also want to see them typing and texting, because that can be very, very revealing. They might have very, very stiff hands when they're doing it, they're very immobile, and then they're using their thumb in an ill-advised way, for instance, for the texting. So healthy practice, again, I hope most of you are very aware of this, but I'll just remind you, and especially it's very, very important to remind one's students of this. It is important to establish a regular routine, because to suddenly increase to 3 hours after you've done just 1 hour a day for the rest of the week is not wise. The hand doesn't respond so well to that. Planning your practice session for maximum efficiency. I get a lot of music students, I hear them practicing in the room next door at my music college, and they just haven't thought through their practice. They're pounding away, they're playing pieces all fast and loud, when actually all they're really working on is knowing the notes, being sure about their rhythm, increasing the tempo, and memorizing, all of which can be practiced at a piano dynamic, and don't need to be practiced initially at speed. So we can really plan to use the minimum of effort in our practice time. Doctors such as Mark, anybody who works with hands regularly, advises that you should aim to have a short rest every 20 minutes. Now, I know full well that if you're an orchestral musician and you're in a 3-hour rehearsal, that seems impossible. But I would say, this should be at the back of our mind. So, for instance, as a pianist, when I'm practicing, I might practice something with my right hand that challenges my right hand for quite a bit. And then I might do something with the left hand. And then I might have a short break. And I don't just go away, have a cup of coffee and chat to a friend for 10 minutes. I'll make good use of that practice, that break time. I might be preparing what I'm going to be practicing next. I might be mentally preparing something, so understanding the harmony, studying the score, looking at all the composer's details, working out the harmonies, deciding how I'm going to practice the next session. Especially with memorizing, I do a lot of that away from the piano, and I'm sure you're all very experienced in practicing on trains and aeroplanes and so on. I learnt my whole grade 8 flute exam on the train going into junior college every Saturday morning. That was my practice of the week. My main practice, and alternating the type of practice that you do if you possibly can. If you've been working on something that's a very fast piece, try and then make a change, do a slow piece instead to give your hands a bit of a rest. If you've been doing one type of technique, say a lot of detached playing, then go into something which is smooth and more legato. So again, it's using slightly different muscles in slightly different ways, so you're not overstraining the same muscles for more than 20 minutes. I think if you're in an orchestral rehearsal, obviously that's difficult, especially if you're an instrument who's playing a lot of the time. But I think you've really got to grab those moments when you've got a few bars off, and absolutely make the most of them. And put your hands down, relax your hands, do some exercises which may be just invisibly. There's one I can show you later on, which help to release all the tension. I'm sure you know this already, but mindless repetition really is a terrific waste of time. Einstein is reputed to have said this particular quote, whether we don't know for sure whether he said it, but the definition of madness is repeating the same thing over and over again in the same way and expect a different result. And this is what you often see with music students. They're practicing and they think, if I just play this 20 times, it's going to be good. And if there's something wrong on the first time, then that means there's something wrong. So they need to readdress it, rethink it, ask their teacher, ask you, what's going wrong, and find out what the root cause of the problem is. And only then, once you've actually got it feeling ease, got it flowing, feeling that it's comfortable, only then do you repeat, maybe increase the tempo, and just play it a sufficient number of times so it becomes embedded in your neural pathways. It becomes in the muscle memory, as we call it. I also find that any technique that uses the body in its most natural way inevitably gives you more freedom of movement. It gives you a softer approach, a softer relationship with the instrument, a healthier relationship with the instrument. And so it actually produces a much, much better sound. Certainly on the piano, if somebody's playing with a very tight wrist and a very tight elbow, and then they're playing some forte chords, there's a jolt to the sound. It's going to produce a sharpness at the beginning of the sound in particular. And so I, as a teacher, use the sound as my guide. If I know that, wow, that improved the sound, either for me or for my student, then I think, right, I must be onto something. And then I'll pursue that and see where it takes me. I think one thing that I'm going to talk a little bit about warming up in a minute. But the one thing that often people forget about is the importance of what you do at the end of your practice or at the end of your rehearsal. And of course, most people quickly shove their instrument in its case and scurry off to the next engagement, or to have a coffee, or to go home. But there are certain things you can do, and there are with each instrument there are certain imbalances. It's not natural. It's not natural to the body to play one instrument for many, many hours a day. Each instrument has its own imbalances. And so, for instance, if you're a violinist and you've always got your hand twisted like this for many hours of the day, and you're sitting on one side, then at the end of the practice you could just undo that balance. So you can't quite see me, not far away, I'll show you later, and just undo the twist, for instance. Only takes 1 minute. Just do that to stretch the muscles in the opposite way. If you're somebody who always sits on slightly putting your weight on one side or on the other, string players are often like this, flautists in particular, then if you know that you always tend to put your weight on one side, then just as you finish your practice, or in a quick break in between, put your weight on the other side for a minute, just to rebalance all your muscles. And just doing a few cool down exercises, as I call them, that means sort of doing a couple of slow pieces towards the end, not just fitting in a flourish and then rushing off, but to do a couple of slowing down things, which is what an athlete would do after their practice session, their training session. So just work a little bit more slowly and maybe do a few stretches or a few loose swings or something, some releasing exercises. So what you're doing is releasing any tension that might have built up in that session, so that you go away, you've released some of that tension for the next 24 hours or whatever, you're working comfortably, and then you're more likely to go back into your next rehearsal session with much more comfortable feelings in your body and in your muscles and so on. Right, Mark. Oh yeah, can we just go on to the next one?
Yeah. Is that showing, Nancy?
Yeah. Right. So, yeah, I hope this is all familiar to all of you. But when I was brought up, I did hear people say no pain, no gain. That, you know, if it's hurting after you've practiced for 4 hours and you've been practicing some, you know, stretches, something forte, then that's good. It shows that you're developing stamina. It is not the case. It really isn't. And we've really got to re-educate ourselves and our students against this attitude. Stamina is comes out of suppleness, out of well-coordinated free movements, and then doing that obviously over and over again. But if we're trying to develop stamina with very imbalanced movements and very tense muscles, what we're going to do is really hurt ourselves. So if you do experience fatigue, as much as possible, and I know that's very difficult if you've got a full-time job in an orchestra, you should rest and ask if you can take some time off for rest as much as possible. And certainly if you experience pain, you will probably have to stop playing for a time, or at least reduce the playing to the level where you're no longer experiencing the pain. So it's not always advisable to stop playing altogether. You know, we can get pretty depressed by not playing altogether. It can be a very disheartening experience. But if you can reduce the playing to the level where you're no longer experiencing the pain, speak to the people in your orchestra about the problem. I know people are very reluctant to do that sometimes, so that to perhaps modify your time scale or whatever, and to seek help. And this is where we are. That's where we are at BAPAM. And usually we can actually see people fairly quickly. Next one, Mark.
Yeah. Is this a good time for us to, after we talked about taking a break and stretching and go for a walk, is this a good time for us to talk about that?
Yeah.
Or
give me 2 more, and then we'll have a break. Yeah, okay, and then we'll have a break. So if you do start to experience some pain, what do you do? And the usual NHS advice or any sort of specialist advice is, you know, you want to be doing something. It will take a bit of time before you can see your GP or you can see a specialist. So what can you do in those first few days? Certainly rest it as much as possible. If you've had the problem before and you've got a splint, for instance, there's no harm in putting a splint on or something, because that will really encourage you to perhaps rest the wrist or give it some support if you're having to lift something. Ice can be very beneficial, particularly in the first 24 hours, because it will reduce inflammation. There is some disagreement about how useful ice is after those first few days. You know, a lot of people think that it's better to use warmth after that. So I think, you know, if you can talk to your doctor about which they think is better, that's really good. Elevation just means, you know, if you've got inflammation anywhere, you know, just bringing it above your heart, putting your hand up, resting it on something, doing this, can just help to reduce any inflammation. And you can buy topical NSAIDs over the counter at a chemist. So the topical just means you put it on the affected area. So it might be that you just put the creams on your hand. NSAID stands for non-steroid anti-inflammatory drugs. Yeah. Thank you. And things like Voltarol, you can buy them over the counter. There's no harm in using those for a few days while you're waiting for a proper diagnosis and some further help. And then obviously, you know, start to put things in motion to seek some medical help, because what's most important is that you get an accurate diagnosis. And there's too much tendency for to just, oh, I've got RSI, which isn't quite precise enough. And the more you've got an accurate diagnosis, so it's actually carpal tunnel, or it's de Quervain's tenosynovitis, or it's golfer's elbow or tennis elbow, then everybody, including Mark and myself, we're much more able to be much precise in our treatment and our advice. And just briefly, I'm going to, those of you who are teachers, I think more and more teachers are realizing that the old-fashioned way of, of treating some students, which actually sadly still does exist, is no longer acceptable. And we also have to assume a duty of care towards our students, not only for their emotional well-being and their instrumental development, but also for the health of their hands. So when I'm teaching, I actually move around the room a lot. I used to sort of sit in one place and then I'd suddenly find, oh, there was something going on in the right hand that I hadn't noticed because I was sitting on the left, or that there was something weird in the neck position which I hadn't noticed because I was sitting in the wrong place. So I move around a lot. And even with Zoom, I ask them to put the camera in a different place so that I can see them from a different angle sometimes. I'm listening all the time because that's my judge of what's happening in the sound. And obviously, if you're in the same room with them, you can really feel for any tension in the wrist and in the elbow. I am actually writing some books at the moment for beginners technique in piano playing, because what I find happens in the piano world is that there's not enough time for teachers to teach all the foundations of healthy technique within the first year, so it tends to get put aside. So I'm creating some books which will be resources for them with exercises that they can use, so that they can really be focusing on getting the technique at its best right in the first couple of years, so that hopefully then we're avoiding any of these problems happening in the future. And I think if you can, within your lesson time, create an atmosphere where the student feels it's safe to inform you of any technique issues or any tension or fatigue, that is very, very important, because you can be their first port of call. You can stand up for them, and support them if they need some mitigation. So they're at a school or got an exam coming up, or they're at a music college. You can be their spokesperson, and you can be that port of call. You develop a very important role when a student has difficulties. And I think it's important to say, not everybody has experience in injuries. But out there are people like myself, like Alison, like Paul and so on, who devoted a large part of their lives to finding out about this, working out strategies and so on. So don't hesitate to contact one of us. We could have a joint session with you and with the student, so we can look at it, just give you some pointers. It'd be good to focus on this. I can see there's some tension there. We're not out there to steal your students from you. We're just there to offer some advice if you want a little bit of extra support and somebody's you're struggling with a student, you just want a second opinion. So we're there for you if you need us. So shall we have a break now? See me okay? Can you see me okay?
Yes, you just pause for a little while then.
Can you see me okay?
Yeah.
Yeah, okay. Right, I'm just going to talk a little bit about some technical considerations. Again, trying to do it very generally about musicians. 20 years ago, I created this video called Yoga for Musicians. You can access it via a website that I call healthypianoplaying.co.uk. And in that, I talk about the various conditions that people get and some technical thoughts that can help to alleviate those conditions. And in that, I give quite a few exercises about how we sit comfortably at the instrument. And I'm just going to show you a couple of things today. Firstly, what I find very often happens is that, of course, the shoulders round. This is to do with us sitting on chairs. throughout our lives, or our shoulders come up and they're very, very tight and very rigid. Now, somebody earlier said, well, do you look at other parts of the body? And certainly, as soon as I see a shoulder problem, I look at the pelvis. Because if you just want to try this yourself, if you just round the pelvis round that way, you see just what automatically happens to my shoulders, they become rounded. If instead I push my tummy button forwards, then my shoulders are much better aligned. So this is something, just a very quick tip. If you find that you're in the middle of rehearsal and you're really starting, but your shoulders are getting rounded, just readdress your pelvis. You can do a few pelvic tilts, as we call them, where you push your tummy button forward and then back, and then forward and back. And that will also keep that lower back moving, which means it's less likely to get painful. One way to judge how far to do that is to put your hands this way up underneath your sitting bones. Because you'll find that as you do that and this, what you'll find is you'll feel the bones either pointing backwards or pointing forwards. And a very useful guideline for that is that your bones actually, ideally, should be pointing very slightly backwards. So if I do that, my bones are pointing forward, I just angle it so I feel my bones pointing very slightly backwards. Take my hands away, and suddenly my whole spine is lined up very comfortably. And I don't have to make an effort to sit up straight. It's just by repositioning the pelvis, it's helped enormously. I mentioned a little bit about warming up. I have a sequence of warming up that I use for all instrumentalists and singers as well. And it's very, very different to the traditional idea, which is where, you sit down and you play some scales, some fast scales to warm up. And that's like doing a sprint in order to prepare for a sprint, a 100-meter sprint. You don't, you work up your speed gradually. And the exercises I do, they are in this Yoga for Musicians series of DVDs. I'll just show you a few of them, what sort of exercises they are. So the first thing is 3 little swings forward and back, and then swings sideways, twisting around the body, and then another one where we're swinging forwards in this way. And the purpose of that is that they really release all the tension in the neck and shoulder area in a very passive way, a very gentle way. So even somebody who's hurt their shoulders and arms can do it at a very modest level if they want. I mean, if I do it, I really swing very high, but if you want to, you can just do a very low swing, and you see how you're really loosening up those muscles all around that area. You can also do exercises where you're just doing some shoulder rolls in this way. So you're just keeping that shoulder joint really, really loose. And the more the shoulder is loose, the more the elbows and the wrist feel comfortable. There is another exercise in that which I call falling water. It's a very strange one. And we're using the image of water and the flow of water to release all the muscles. So if you get a chance to look at that, that is really, really beneficial, because it's the sort of thing you can use in the middle of a rehearsal, or even in the middle of a rehearsal. The other thing you can do is imagine that there's water swishing down your body into your pelvis, and it gives you a sense of real sort of grounding. If you've been feeling a little bit nervous, it'll just settle you back down again. Now, somebody mentioned about that she was getting, I think it was golfer's elbow with lifting the instrument, and not surprising, viola's a heavy instrument. So in any instrument that you have to lift, what we're trying to do is to engage the stronger muscles of the back area, the shoulder area, to take the weight of the instrument. And if we're taking the weight from all around this area, then and tensing the elbow in order to hold the instrument up there, then inevitably, some things can get really strained. So what we're trying to do is to engage the stronger muscles. I have an exercise that I call the swan landing. So I'm a bit stiff in the left arm today because I had my booster jab yesterday. And I do this movement, which is hands up. It's a figure of 8 in this way. Now, I tell people, really feel that you're moving right from the center of the spine, right from the front. And so what that does is it does several things. It really gets those muscles working so that the arms aren't working so much. It's all the stronger muscles which are supporting the arms. And then from there, you maybe go to your instrument wherever it is. And so and then you can pick up your instrument and actually maybe put it into your arm there, or whatever, however it's going to work for you. But we want to be using the stronger muscles to hold up the instrument, and in order to do that we have to activate them before we even start playing. The other good thing about that exercise, for instance, is what it does. It opens up the chest here, so it does this, and then as you bring your arms back you can maintain that openness of the chest, so you don't have to go out and then come back in again, which is what a lot of pianists do when they're playing in the center of the keyboard. So we're opening out the chest and then coming back to whatever your playing position is, but you've got that support of all those stronger muscles to play forte, to hold your instrument up. Hand-arm alignment. And so if I just walk down the street and I'm here, and you'll see that my back of my hand is pretty much in line with the back of my forearm. And that is the natural position for me to be in. That's my position where the hands are most in balance. Now, if I'm always playing with a very low wrist or a very high wrist, then say I'm playing with a low wrist, these muscles are being pulled tight, these are working hard to pull them in, and vice versa for the other way around. And the body then becomes out of balance, muscles aren't working in their most natural way. So as much as possible, and that's not always possible with every instrument, we aim towards using that midpoint of the movement, the balanced position, the natural position, as the midpoint of our movement. So, on the piano, for instance, I'm often playing a little bit lower, a little bit higher when I need to, but I'm working around that midpoint, which is the healthy ergonomic, the most healthy position to work around, and it's the most efficient. It's it's the position from which the muscles work at their best. Supple joints, obviously, I don't think that needs to be explained. I'm sure you're all aware of that. I mean, none of us would jump off a wall and brace our ankles and land with stiff knees and with stiff ankles. There'd be a little bit of a give. Otherwise, we're going to jolt all the joints. So supple joints is something we all need to just keep on working at in all aspects of technique. I work a lot on some careful strengthening exercises, and also if you have any problems, a hand therapist can really help with this, but they have to be really specifically for your particular problem. So for instance, we get a lot of pianists whose hands are very weak here and they're very weak on this joint. I can't demonstrate very well because I'm very strong there. So I do some exercises just to very gently and progressively, not all in 1 week, but over, a few months perhaps, to strengthen this movement and this movement. But they have to be carefully planned so that they're right exercises for the particular weakness that the student has, especially for students with hypermobility. They may well need some extra strengthening exercises. And I think one of the most important things to be looking out for is moments of tension and release. Certainly at the piano, one of the worst problems is playing forte, something at a stretch, say an octave, and it's repetitive. That's really, really hard on the body. So what we should all be doing is looking for the moments of, maybe a couple of bars when you've got a rest, or it might just be, you've got a staccato crotchet, and in that gap between that chord and the next, you've got a moment's rest. And so, for instance, I'm always telling my students, say you're going from here to here, or here to here. In that moment of moving from there to there, you actually let the hand rest. And I think we can all, so we're letting the hand come as much to the possible as jelly. I talk about jellyfish motion in that, so that then they develop the habit of using the minimum amount of effort for the maximum musical result. So we're avoiding keeping the hand tense when we don't actually need it. And for those of you who are maybe second study pianists, just the biggest things to avoid are playing with these really high curved fingers in that way. It's how piano playing is still taught in some places. A lot of books of exercises based on the idea that you lift high and with precision, Hanan, Doknani, Pishna, all these exercises, they are actually very dangerous. And I've had more students come to me with serious problems who've done a lot of work on those exercises than anything else. So they should be treated with caution. And again, pressing into the keys, so really pressing down hard into the keys with a tight wrist, with a tight elbow in particular. And then continuing to press when actually we don't need to, again, is a very common fault. We need to drop it in with gravity onto the keys. And then once we're there, we just rest on the keys. We don't need to be pressing. We just let the hand rest. And we just are very cautious about, any extreme technique. We just work at it just for short periods of time. So that's the end of that section. So if anybody has any questions on those sort of issues, you want to bring them over to me? I'll go back into where I was. Seem to be a lot of things in the chat. Is there anything that we should really deal with at this moment? Joe and Jennifer?
You can see my slide there. Cool. Yes, over to you then. Can I be on your technical considerations?
No, I've done all of that.
Oh, you've done all that. Okay.
That was the bit I did away from before the when you put the PowerPoint off.
You've covered that. Okay, and this, you've covered that?
Yeah, covered that one. So now we're on to your one.
Okay. Yeah, we've run a lot of questions, haven't we? So I was just going to talk about the type of treatments that I do, and Glenna helpfully answered with steroid injections. I've covered quite a lot of that. I do a lot of steroid injections, find them very helpful. They can sometimes be really helpful diagnostically as well as therapeutically. A lot of things that musicians get are below the threshold of standard imaging techniques to pick things up. And it can sometimes still be a diagnostic conundrum despite careful history taking, careful examination, MRI, ultrasound, X-rays, and there's still nothing to see, but it's still enough to be knocking somebody off the top of their game as a musician. Sometimes this localized tenderness or a tendon that seems to be tendinopathic sometimes patients will only have pain at the end of a 4-hour session, then it goes away completely. So they come for a scan the next day and there's nothing to find. Or they come to have nerve conduction studies, there's nothing to find. And the only way to get around that is to put a steroid injection in that works for about 6 weeks and see if during that period of time the symptoms are easier. And that can be helpful diagnostically, and as well as often in the long term therapeutically as well. So that's why we use them a lot. Ian Winsper, who did this for 25 years before me and wrote the books on the subject, used increasingly steroids a lot, and they seem to be very safe. And all the patients I inherited never had any long-term problems from them.
Mark,
yes.
May I jump in there? Just to reassure though, because I think most musicians are very nervous about having steroid injections, and that isn't our first form of treatment. We always look at technical modifications. We also look at hand therapy. We look at other things, and it's when those type of things are obviously not enough that's when Mark jumps in and says, "Well, I think you should have a steroid injection." He doesn't push it on anybody. It's talked through very, very cautiously. But
all doctors are pretty much trained in sort of hierarchy of intervention. So, like, do the most rudimentary things about lifestyle adaptation first, and then physiotherapy, and then more sort of clinical things such as medication, and then injections with invasive sharp things through your skin, steroids or surgery, and it's all kept to last resort. So a sensible doctor would hold those right back. And as you go through your career, as you get older, you start to be more and more conservative. And that's noticeable in people's figures of what's called conversion rate. So, liaison with hand therapy, we often penalize people coming through their hand surgery exams as trainees for not talking about hand therapy early on in their management strategies of patients. And they're very useful colleagues indeed. They're highly trained So they become either occupational therapists or physiotherapists, and then they do a hand therapy diploma, which is a several-year course, and then they only work with hand surgeons, and they become very good at what they do. They make splints, very good about orthotics and devices that are available, either bespoke or off the shelf. And then these specialist clinics are an intervention. I regard them as an intervention. So you've come to a point now where it'd be good for me to work with a technique educator. I certainly don't send all my patients along this route, but I would say you are in a position now where it'd be really good for us to look at a technique workaround and let's see if there's anything in terms of an instrument adaptation that we can do that a technique educator would be better positioned to advise me on. So these are the sort of tests I do on everybody, whether somebody's a musician or not. Nerve conduction studies, MRI scans, studies for carpal tunnel, cubital tunnel, and other nerve entrapments, ultrasounds, X-rays, all very commonly done. And this is a scatter of all the different things that the words that come up in my letters. Steroid injection, quite common, hand therapy, decompression of a nerve or a tendon, and general and local anesthetics. For procedures, some patients need biopsies, excision of things. And occasionally we go to companies that will do ergonometric adaptations of instruments, and I see patients bring their instruments in and they show me which ways in which they've been modified. I had somebody the other day brought his saxophone in and he's put a penny coin on one of the keys with some blue tack and tape, and that helps him get a grip on one of the keys because of one of the problems he has with his finger. And he says that the portcullis side of the penny coin is a better tactile sensation than the Queen's head side of the coin. So yeah, there's all these subtle little things you can do to work around a clinical problem. Then we do surgery sometimes. Everybody's very frightened about surgery, and we're all cautious about doing that. In lockdown, we had lots of opportunities to do operations that people have been wanting to have for a long time and have done to recover. But now that everybody's back to being manically busy with playing music, making up money, and also fulfilling the need that everybody has had for listening to live music, they're not quite so keen on having surgery now. And this would be possibly the worst time to do an operation for somebody. We have to consider lots of different things like choosing your incision. So that's why I'm preparing this document about, for many reasons, this Googleable, this searchable photographic image database to show what the contact points of the instruments are. Partly for surgeons choosing their incisions, and how they're going to approach a thing and which parts contact the instrument. That's really important for us. And also to look at the positions that fingers are typically in when they're reaching for certain parts of the instrument. So we find that really useful. If we're going to fuse a joint in one position, then of course we need to know whether that's a reasonable thing to do for an instrumentalist. And sometimes, in rare cases, it is the right thing to do. And it has helped people get out of pain, but it means that the joint doesn't move anymore. But you can choose the position by, say, if it's a finger, for example, you can get a hand therapist to make splints in different degrees of flexion at the tip of the finger, and then the musician can try that out with its different splits and work out which position is best for them, and then I can fuse the joint in that position. And of course, a big part of this is managing expectations. You certainly don't want to oversell it. I've had a very helpful patient with an excellent result has managed to put up on a blog of his wonderful recovery. And of course, the trouble with that is that everybody's expecting to recover as well as him. So I'm very careful to point out to people that not everybody has a straightforward recovery, and there's a wide range of recovery to be expected, and all sorts of things that can go wrong with surgery, such as infection, stiffness, bleeding, scar hypersensitivity, problems with many things, as you can imagine. And so I do discuss that very carefully with people before we come to that. And generally, it's best to make a decision about surgery when it's a no-brainer, when people can't pick up a cup of tea or they can't play their instrument at all. Then it's a bit easier to decide to have an operation than it is if you're still in full flight and you can still practice and perform as much as you like. Yeah, so that pretty much brings me to the end of all of that. There's lots more we could chat about, but we've got all of these resources here that are available. And I think a large part of my clinic appointments, particularly on BAPAM, is directing people to websites, and I get them to go to different, get all my patients to go to different websites. while they're on the chat with me, so they've got them in their browser as part of their history, so they can go back and look at them again. And these are all fantastic resources.
Mark, can I just remind them about the funding options that are available?
Yeah.
So I'll leave the MU to talk about theirs. But for instance, there's this organisation called Help Musicians, which used to be the Musicians Benevolent Fund, I think.
Yep.
And you can, so say for instance, you see one of us, so you see Mark in the clinic, and he feels that you need some treatment that can't be achieved on the NHS, it's going to be costly. He can recommend that you apply to the Help Musicians, and they can often provide some funding for it. The Royal Society of Musicians also has some funding help, so you can get in touch with them directly. And Joe or Jennifer, do you want to just talk a little bit about what funding options you have?
I see Jennifer's just put the webpage link up there as well. That's helpful in the chat.
Penelope, we thought rather than take up time on the session, we're going to send out all this information afterwards, if that's okay. But thank you for pointing everyone towards those resources. We would have done the same. But we will members' details of the the MU Benevolent Fund. Sorry.
Right. Yeah. Great. So we've got quarter of an hour.
Question from Rebecca Hammond.
And finally, thank you so much to Mark and Penelope for today. An amazing session. I can't believe you fit so much into 2 hours. And for everyone that attended, thank you for coming. And we will be sending all the information, all the links that have been on the chat, all the slides, and a whole host of other information from the MU will be coming your way. So thank you again. And do feedback to us about what you thought. Bye.